Today we will talk about hidden signs of iron deficiency every woman should know. Do you feel bone tired all the time, but your doctor says everything looks normal? You do all the right things, you try to get enough sleep, you eat well, but you're still just dragging yourself through the day, completely running on fumes. What if the real reason isn't about more sleep or less stress? What if those weird cravings you have, your restless nights, or even how your fingernails look are actually clues? Your body trying to tell you something important is missing. In this video, we're pulling back the curtain on the strange and often ignored signs of low iron that every woman should know. Your body is talking. It's time to listen. The iron elephant in the room. Before we get to the really strange symptoms, let's do a quick refresher on why iron is such a big deal. Think of iron as the superstar delivery driver for your body. Its main job is to help make hemoglobin, a protein in your red blood cells. Hemoglobin is what grabs oxygen from your lungs and delivers it to literally every single cell in your body. Your brain, your muscles, your skin, everywhere. When you don't have enough iron, you can't make enough of these healthy, oxygen-carrying red blood cells. It's like a delivery service trying to operate with half its trucks. Everything just slows down. Your brain doesn't get enough oxygen, leading to that foggy feeling and headaches. Your muscles don't get enough, which is why you feel so tired and weak. That's iron deficiency. And for women, this is an incredibly common problem. Because of things like monthly periods and pregnancy, a huge number of women are iron deficient, with some studies suggesting that about a third of all women under 50 are affected. Yet it's missed all the time because the first signs are either vague or just plain weird, and so easy to blame on something else. You're told it's just stress, you're not sleeping enough, or it's just part of being a busy woman. But that deep, weary exhaustion and all the other strange things happening to your body are real, and they might all point back to this one single mineral. The strange cravings, pica. All right, let's kick things off with one of the weirdest signs, something you might even be doing without realizing it. Do you find yourself constantly chewing on ice? Craving that crunch, filling up your cup again and again. This isn't just a quirky habit. It's a real medical sign called pagophagia, and it's a common form of a condition called pica, an intense craving to eat non-food items. Pica is very, very strongly linked to iron deficiency. While scientists don't know the exact reason, one top theory is that it's the body's confused, desperate attempt to get the minerals it's missing. Another idea, specifically for ice chewing, is that it might briefly boost blood flow to an oxygen-starved brain, giving you a quick moment of alertness. The urge can be overpowering. And it's not just ice. People with iron-related pica might crave dirt, clay, paper, chalk, or even just the smell of things like laundry detergent. Many are too embarrassed to ever bring this up with a doctor. But for lots of people, these strange cravings vanish, almost like magic, within days or weeks of starting iron supplements. So if you have an unexplainable urge to crunch on ice or you're drawn to other non-food things, don't just brush it off. It's one of the loudest secret signals your body can send. The restless legs syndrome. Picture this. You've had a long day, you are completely exhausted, and you finally crawl into bed. But just as you start to drift off, it begins. A strange, uncomfortable, maddening feeling in your legs. It's not a cramp or a pain. It's a creepy, crawly, fizzy, almost electric sensation with an overwhelming urge to move. This is restless legs syndrome, or RLS. So you kick your legs, you stretch, you get up and walk around, but the relief is only temporary. The second you lie down, it's back, keeping you from the deep sleep you desperately need. If this sounds familiar, you're not imagining it. And one of the most well-established causes of RLS is low iron. Here's the connection. Your brain needs iron to produce dopamine, a chemical that helps control muscle movement. When your iron levels are low, especially the iron stored in your brain, it messes with these dopamine pathways, which is thought to trigger that uncontrollable urge to move. And here's the kicker. You can have RLS from low iron even if you're not technically anemic. Your main blood tests might look fine, but if your brain's iron supply is running low, it can set off these frustrating nighttime symptoms. It's a classic sign of a nutrient deficiency that so many women pass off as stress or just another bad night's sleep. More bizarre clues your body is sending okay. So besides the ice cravings and nighttime jitters, your body sends out other, more subtle clues. You just have to know where to look. First, check out your fingernails. Are they strong, or are they getting thin, brittle, and maybe even flat? In cases of long-term iron deficiency, nails can develop a condition called koilonychia, also known as spoon nails. The nail becomes so soft and curved inward that it can literally hold a drop of water. This happens when a lack of iron and oxygen messes with the healthy growth of your nails. Next, listen. Are you hearing a weird sound that nobody else does? Like a ringing, buzzing, or even a whooshing in your ears? This is tinnitus, and a specific type called pulsatile tinnitus, where you can actually hear your own pulse, has been linked to iron deficiency anemia. When you're low on iron, your blood can become thinner, and your heart has to pump harder to move oxygen around. That extra forceful, turbulent blood flow can sometimes become audible in the small blood vessels near your ears. Now, take a gentle look at your inner eyelids. Pull your lower eyelid down and look in the mirror. Is that area a healthy, vibrant red? Or does it look pale pink or kind of yellowish? That rich red color comes from having plenty of red blood cells. When you're iron deficient, that area can look noticeably pale, giving you a quick visual clue of what's happening on the inside. Finally, notice your tongue. A healthy tongue is pink with lots of tiny bumps. But with iron deficiency, a condition called glossitis can develop, where the tongue becomes swollen, sore, and weirdly smooth as those bumps start to fade. You might also get painful cracks at the corners of your mouth. Any one of these signs on its own is easy to dismiss. But when you see them as a pattern, a clear picture starts to form. A body that's crying out for a nutrient it desperately needs. Before we get to the solution, I have to ask, have you ever experienced any of these signs? The ice chewing, the restless nights, the weird nails? Let me know in the comments. It's so important to know we're not alone in this. And your story might be the one someone else needs to hear to finally go get answers. The solution, how to take back control so you're exhausted, you've got brain fog, and maybe a few of these other weird signs are hitting home. You go to the doctor, they run a standard blood test, a complete blood count, or CBC, and it comes back normal. They tell you you're not anemic, so everything must be fine. This is the frustrating reality for so many women. Here's the most important thing to remember. Not anemic does not mean not iron deficient. Anemia is the final, late stage of iron deficiency. You can suffer from low iron for months, or even years, before your blood count finally drops low enough to be called anemia. The key is knowing that a standard CBC isn't enough. The single most important test you need to ask for is a asterisk serum ferritin test asterisk. Ferritin is the protein that stores asterisk iron in your body. Think of it as your body's iron savings account. A CBC looks at your spending money, your hemoglobin right now. A ferritin test looks at your savings. You can have a normal amount of cash on hand, but have a totally empty savings account, meaning you're right on the edge of a crisis. A low ferritin level is the earliest, most sensitive sign of iron deficiency. Many labs consider a ferritin level as low as 15 ng/ml to be normal, but a growing number of experts argue that many women feel symptoms when their ferritin drops below 50 or even 75 ng/ml. This is where you have to become your own health advocate. Walk into that doctor's office armed with this knowledge. List your symptoms, all of them, especially the weird ones, and specifically say, I'd like to have my ferritin level checked. You are the expert on your body. You know when something is off. Don't let a normal CBC be the end of the conversation. Pushing for that ferritin test is the first, most critical step to getting a real diagnosis and finally feeling like yourself again. That deep fatigue that never goes away, the obsessive need to chew ice, the creepy-crawly feeling in your legs, the ringing in your ears, the changes in your nails, these aren't just random quirks. They are a constellation of symptoms, a secret language your body uses to tell you it's running on empty. For way too long, women have been told their exhaustion is just a normal part of life. We've been dismissed, and we've dismissed ourselves. But these signs are real. That bone-deep exhaustion isn't just in your head. Understanding that these clues point to a potential iron deficiency is the first step toward reclaiming your energy and your health. Listen to your body, advocate for yourself, and demand the answers you deserve. If this video opened your eyes to something new, please give it a thumbs up and share it with another woman in your life who needs to hear this. You never know who's struggling in silence. And don't forget to subscribe for more deep dives into your health. Thanks for watching. Your body is talking. It's time for us to listen.